Good evening from Greece, but also good morning and good afternoon, since we have attendees in different time zones. It's a great pleasure to welcome you all to this webinar entitled The Healthcare Leader of the Future with Professor Nora Colton, the inaugural director of the UCL Global Business School for Health. My name is Ianis Matsoukas. I'm the executive director of Metropolitan College Global University Hub. Metropolitan College is the leading private higher education institution in Greece and the largest transnational education provider by enrollment in Europe. The Global University Hub is the region's largest university hub, home to key global universities offering diverse academic and professional programs. One of these programs, the Leading and Managing Change in Healthcare, has been designed by the UCL Global Business School for Health and will be delivered in Greece this May in collaboration with the Global University Hub. The UCL Global Business School for Health is the world's first business school dedicated to health. It was established in 2021 in response to an increasingly urgent and worldwide need for improving healthcare leadership and management. So we're very happy, we're very glad to have Professor Colton with us today. We're very keen to hear Nora's views and reflections on how healthcare leadership is changing due to market trends and the new skills, mindsets, and desired outcomes healthcare executives need to thrive in the era of polarity, paradox, and change. Thank you for joining us, Nora.
Well, thank you so much for having me. And it's a pleasure really to have the opportunity to talk to you about myself, what we're doing at UCL, and moreover about our program in leading and managing change for healthcare. First of all, let me just introduce myself. I'm a professor of health and economic development. I have my PhD from Oxford University, and I have had a career that spans decades in terms of really looking at development, particularly in the Middle East, and also in terms of health and healthcare. And it's a real pleasure now to be the director at the Global Business School for Health. Health has never been more important and such an integral topic that we're all very interested in worldwide. I think, healthcare is expanded. It takes much more of our GDP than ever before, with, most European countries spending upwards to about 10% of their gross domestic product on health and healthcare, and in places like the United States, up to 18%. So understanding the kind of business imperatives and the need to change and rethink our health systems never be more important than it is today in the world that we live in. So I am very proud to be able to be part of this leading and managing change for healthcare, and to work with the Metropolitan College and to be able to bring this to Greece, because I think many of the challenges that we see across Europe and also in places like the Middle East, and Greece is such a strategic location for all of these areas, are experiencing many challenges in the healthcare sector. And I think one of the things that we need is courageous leaders who understand transformational leadership and can really address the changes that are needed to take health and healthcare forward for the betterment of the population.
It's a great opportunity. We're very glad as well as Metropolitan College to offer this particular program in Greece. This is the start of a very successful partnership. So now to focus on something that you said earlier about disruption, transformation. So everyone talks about disruption today. And some people say that, it's really uncomfortable. So can we just avoid disruption in the healthcare sector? Is it possible? Is it feasible?
Well, I think it's a really good question. And sometimes we do hear the word disruption used so much that it becomes almost cliche. We're not sure what it means. I think in the terms of healthcare, it's very specific. Most of us, and particularly those of us who live in Europe or in societies where demographics means that our populations are actually aging, we see that the model of health and healthcare that we've had in the past that grew organically out of the need for central locations, for hospitals to be really hubs and centers for care, that model isn't working very well for us today. So when we talk about disruption in healthcare, many things come to mind, and one of them is that we need to change our model of care. We need to, we've recognized that therapeutics, treating people in hospitals, taking them and having them see specialists in particular, is not good value, neither for the individual or for the society they live in. So there's a major transformation, and I think that's where the word disruption. And also we associate that word with technology. And of course, part of that story of making that change from a hospital model to one that's much more embedded in and agile in our communities, that's based on population health management, based on primary care, based on preventative care, rather than on treatment and therapeutics. That is a major disruption that has to take place. So I don't think we can avoid it. And we definitely cannot treat and have access and fairness in healthcare without some sort of change and change process. But change isn't easy, and healthcare is something that is difficult to change because we're so embedded in our practices. So for many societies today, the idea of moving away and refiguring their healthcare is quite a daunting task. And that's where understanding change management, the processes, how to build a case for change, and then how to take that case forward is so integral to really getting us where we need to go as societies.
Yeah. You mentioned earlier the states and the healthcare system in the states, and in the states there is so much talk in the last few years regarding the Great Resignation. Is it a reality in the UK or in Europe? What are some of the actions you expect healthcare leaders will do or need to do to retain their best healthcare personnel?
Well,
to stay in the sector, because we can see some of the person moving in completely different sectors.
Well, you've landed on an extremely important point, and that is around workforce. And healthcare, like many sectors of the economy, is seeing lots of change in the health, workforce. We're also seeing not just what I call, the resignation, the Great Resignation, and the Great Resignation was coined, in the United States, and it was based on really the idea that so many people after COVID just decided to either take early retirement, not to return to the labor force. But I think what we're seeing in healthcare actually is not so much the Great Resignation as the quiet resignation. People who come to work, but they don't put in the same energy. They don't have the same passion for what they do because they feel they're burnt out, they're tired, they don't feel that the senior leaders are necessarily listening to them. And so that is really a deadly combination. When you have those people who've left, often, doctors, physicians, nurses who've taken early retirement, and then you couple it with a demoralized workforce that shows up but has quietly resigned, who is no longer, giving the extra, but they're giving just enough. And unfortunately for healthcare, this is a real pivotal moment. And it isn't one country that's experiencing this. It isn't one hospital that is experiencing this. This is a worldwide phenomena in the health and healthcare sector. So I think one of the key things about change and change management is we all need to recognize we're not going to solve this problem by just trying to train up more doctors and nurses. We need to use and couple three things. We need to couple technology, data, and people. And that is really, those three things are going to be integral to the solving the workforce crisis in healthcare today. So what do I mean by those three things? Well, first of all, we need to get much more data driven. We need to understand our workforce, not just from an intuitive level, but actually from, a data driven perspective in terms of who they are, where they're deployed, how long they stay. Just recently, some research came out talking about how, many employees want to work from home, and it's astronomical, but yet employers and more people are being forced back to work. So we've got a new generation. We've got different people coming to the workforce. They have different expectations of employers. And actually, most of the surveys also show that employers overestimate their understanding of their employees. So again, using more data, understanding who our staff are, where they come from, what is their perspective, how can we adjust the way we work? And that's where technology can make such a difference in healthcare. So, we also see things like telehealth, which was, critical for the period when we had COVID and made a huge difference in so many ways. It allowed us to continue to treat people, to see them. But yet we've seen a huge drop now in telemedicine and telehealth post, the heart of the pandemic. Why? Well, we've done research and we know why. Part of the reason is that many employers didn't adjust the way that people work when they went back. So now we have people trying to do double time. They're trying to actually keep telehealth going, and they're actually going back to their old routines and habits and job descriptions. The places where telehealth is still thriving are those organizations that really invested in it. They created it and embedded it. They didn't just tack it on. So there's many lessons that we can learn from the rapid changes that we had to make through the pandemic. And sadly, many of those, why they didn't last in different kinds of organizations. And that's a real part of also understanding our workforce. And then lastly, people. I often hear people say, we just need more clinicians, we need doctors, we need nurses, we need to pay them better. Absolutely, we need to treat our workforce better, but we need to also understand the different pathways. How do we treat people? Do we need everyone coming to the hospital? How can we keep people at home? How can we treat them in the community? So we need to take a holistic, systemic look at our health care, not make short-term kind of jerk reactions to certain bottlenecks. Because many of those bottlenecks are because either our social care at the end, our hospitals don't have enough beds. There are also many other reasons why people are feeling pressured in healthcare. There's not one answer, and that's where leadership and management are so integral to that kind of thinking and ability to look at it systemically, come up with those big answers, and then drive that change.
Yeah. So the future of healthcare then will require the sector to develop, nurture, and promote novel leaders, new leaders, those leaders that are inventive, collaborative, forward-looking, customer-oriented, and more value-based. And as a biotechnologist, I can see if the sector, if healthcare doesn't bring in leadership that will reinvent the healthcare industry from the inside out, disruptive innovators from other industries will reinvent it from outside in. So this has already been happened in some fields. So we need this change, this transformation, and this disruption, to link to the previous question. So again, there's another question which is linked to that one. In an industry, the healthcare industry, that has been riding the wave of standardization, how to get healthcare leaders to lead in the era of personalization?
Well, this again is a very important question, and it's multifaceted. I often hear, particularly in countries where public health and a big role for the state in the healthcare system exists, that healthcare leaders often don't feel empowered. They don't feel able to actually make the changes, even when they recognize those changes. So one of the things that I really focus on when I'm working with healthcare leaders is getting them to recognize what they do have control over and how they can work within their organization, work with, human resources. We just talked about workforce, how they can work with their finances, how they can work with procurement, these different elements, and where they do have control. And, even when we talk about strategy, what is the relationship with politics and power? And, if you're in a country where, elections are on a very short time horizon and you're in a public hospital or a public health system, then you need to think about how do you align. You don't go for a 5-year strategy that's going to straddle two governments. And so there are ways that you can start to think differently about how you move in an agile way and are more adaptive. And I think for me, I'm a big believer in strategic leadership, that ability to horizon scan, that ability to think not just about the intended consequences of your actions, but the unintended consequences of your action. And that is so important. And then I think lastly, it's recognizing that we need to get into a kind of growth mindset in the health sector. We need to start framing our situation in a way that allows us to, make mistakes, to learn, to experiment, and really, have that psychological safety for our staff and ourselves to speak up, to note things, and I think that in a traditional standard kind of health system has not existed. And as you rightly pointed out, the disruption subsequently will come from outside the health system. And so, we need to also recognize that the health system needs to become much more integrated. And we need to see it as an ecosystem with lots of different players. It's not just the hospital sector. It has pharma, biotechnology, digital health, and it's bringing these different actors together and seeing it again, the World Health Organization, the stakeholders that we have today in the health sector span much bigger area, and yet we continue to address and stay in our silos. We often educate in our silos. So we need to be thinking about how we can create not a boundless, but widen those boundaries. Think of the new skills that we need, the roles that we need to move away from that traditional model into a health system that can address the future of our populations.
I totally agree, and especially agree with one of your first points. If leaders don't keep up or are afraid to make bold choices, most of the times they become irrelevant. So leaders, need a lot of courage, and they need to be comfortable taking a risk for something that they believe in. There are a few recent examples in pharma and biotech industries. And let me go with the last question. Is it feasible to work towards resilient healthcare systems that can meet the challenges of the private and the state sectors and provide safe and equitable access to healthcare? So in Greece, we have a mixed health. We have all the models of the healthcare system, have been applied in Greece, and we're still working on this. So is it feasible to provide safe and equitable access to healthcare in a healthcare system like that?
Yes, well, I think, again, fantastic question. And I am a firm believer in public-private collaboration. I think we cannot have equitable healthcare without a strong public sector in our health system. And yet we cannot have really an efficient health system without the private sector. So we need both sides of it. I think what we need to be focusing on is not so much whether it's private or public, but where is the value proposition, and particularly that value proposition as it relates to the patient and the population. And I think we need to get both sides working together. I think there is definitely a role for both sides. As I said, particularly if we take a more systemic look and holistic look and think about that health ecosystem as straddling not just the kind of clinical aspects, but public health, social services, the pharmaceuticals, and medical devices, the whole range. I think it would be very short-sighted to think that we want to place this all under the public sector. And I think it would be equally as short-sighted to think that we want to put it all under the private sector. I think when we think about health systems, really, we think about them doing three things. We think about them providing, of course, we need high quality care. We know that there are many systems out there that provide free at point of delivery care, but often they don't provide high quality care. We need that accessibility. Everyone in our population should have the right to have health and well-being. And of course, that's one of our sustainable development goals as well. But lastly, it has to be affordable. We cannot have people who undergo catastrophic financial discomfort and collapse due to having to try to treat their loved ones or themselves to remain healthy. So those are the three things. And when I think about those three things, I don't see the word public or private exclusively on any of them. I think it is about really merging it, bringing it together, and making the system work first and foremost to patients and populations.
It's a collaboration, can be indirectly linked to that one, and so the future healthcare leaders they must promote collaboration, not just between physicians or nurses, but with every department and perhaps with other organizations in the larger healthcare ecosystem, private and state. I think that's a nice way to conclude the webinar. It has been an extremely informative, and we're grateful, Professor Colton, for giving us a flavor of what the future of healthcare looks like. In closing, on behalf of Metropolitan College and the Global University Hub, I would like to thank you for your time. I know that you have a very busy schedule, and we look forward to welcome you in Athens this May. Thank you very much indeed.
Great. Thank you so much. And it's my pleasure.